Today we have Exo Technology, and they are going to be presenting their company, which is AI-powered wellness monitoring for senior care.
This is Alice, my grandmother, who's 92 years old and lives by herself in rural Nova Scotia. We live an hour and a half away in the city, and we do our best to make sure that she's okay. But most days we have no idea. And what we realized is almost everybody has a story like this. Someone you love is getting older. Maybe they just got back from the hospital. Maybe they live alone, or maybe they're in a care facility and you're wondering if they're really okay. You call, you visit when you can, but most of the time you're just hoping. That's why we built Exo. So families like my own don't have to hope, and care teams don't have to guess. The senior care industry as a whole is facing a crisis right now. By 2030, more than 1 in 5 Canadians will be over the age of 65. And within that same time span, long-term care homes will need more than 58,000 additional nurses and personal support workers, which is not going to happen. And seniors are going to pay the price for this. Falls are already costing Canada more than $10 billion every year, and that is just one piece of the puzzle. So, what does Exo do about this? Well, let me introduce Exo Guardian, a care intelligence platform that doesn't just monitor, but understands. We capture data using wearable sensors to collect functional health and behavior 24/7, which we fuse together to give us the ability to turn this raw data into meaningful context. We then take this context and it gives us the ability to act by auto-generating personalized programming, streamlining workflows, creating caregiver reports, and delivering family alerts and dashboards to keep you in the loop. The question then became, how do we deliver this to the people who need it? And what we found was that rings outperformed every other wearable by more than 400%, which was amazing. So we set out to put our system inside of a ring. And we tried every third-party ring wearable on the market to see if any of them allowed us to accomplish our vision, and none of them did. So, logically, we built our own. The Exo Ring is purpose-built for senior care and designed to capture what actually matters in aging, from grip strength for frailty, to gait analysis, to capturing activities of daily living, which are the activities most correlated with independence as you age, and used as a standard of care globally. But it's not about the ring. It's about what the ring lets us learn. Wearables have been around for decades, and what's new is what AI lets us do with the data they produce, especially in a population as understudied and as patterned as long-term care residents. We establish baselines for each resident, which allow us to surface early warnings based on subtle changes that occur days before visible decline. We compress hours of raw signal into paragraphs that are easily understood and digestible at a glance by nurses and care staff. We have this all built on our model-agnostic cloud infrastructure, where we leverage best-in-class artificial intelligence models, most of which are designed in-house and constantly being improved on data only we own. So, we're currently in the middle of a 6-month paid pilot, and we're seeing amazing results. We're seeing 90% device utilization versus 21% industry standard for wearables, 100% resident satisfaction, as well as 97% AI accuracy in catching meaningful changes in baseline patterns. We filed our IP on the system architecture, artificial intelligence models, as well as the proprietary hardware innovations. And we've received funding and support from, but not limited to, the Center for Aging and Brain Health Innovation by Baycrest, IRAP, Invest Nova Scotia, Springboard Atlantic, and just graduated as part of the CEL 2026 cohort. We are the right people to build this. We've got our CEO and co-founder, John Wang, who is a certified hardware electrical engineer. So he has experience taking products from the prototype phase and developing them for mass manufacture for many of the largest car manufacturers around the world. My background is in biotechnology, and I previously worked at Pfizer, where I was working on internal artificial intelligence tools, as well as working in medical affairs, so I understand the regulatory side of things. We've now brought on Kevin Rimmer as our Chief Growth Officer, who is a 3-time digital health founder, as well as a CDL alumni, as well as our Chief Design Officer, Juno, who previously worked at Tencent and OPPO, as well as our amazing team of advisors. Due to the traction we've been getting from our pilot and the amazing results we've been seeing in the stage of our development, we believe it's time to take in some funding to allow us to secure some additional pilots and prepare for a price round. EXO aims to be the wellness intelligence layer every care home runs on, invisible to residents, but indispensable to the people who look after them. Thank you. Perfect.
So your story obviously personal, and I think probably particularly as folks get to my age, their parents are getting to those years where they have a fall. My mother had one close to a year ago, and obviously something that is on our mind a great deal. One of the areas that I thought was really interesting, you indicated that any of the existing products didn't serve what you guys were trying to accomplish. And that's really interesting because obviously as an investor, I'm first looking at it and saying, well, why aren't they wearing one of the existing wearables? What is it about the information that you're tracking and gathering that's actually doing it differently? Why is this the platform that people want to invest in?
Yeah, for sure. So there's a couple components if we're going to talk about strictly hardware. Most of the general wearables, I won't name them here, but they track broad health metrics, and specifically they track them at a low frequency because there's only so many parts you can fit inside a ring. It's pretty small hardware wise, as well as a small battery. And so you really need to be purpose built for one specific domain. The problem is that a lot of the general wearables try to do everything. They try to capture as many metrics as possible without being very detailed in any of them. And that's something that I know a lot of companies are shying away from now as they're realizing this is a big problem. But redesigning your product from the ground up to do something purpose built is difficult. And so when we went into the aging space, we realized that what really matters is having an ability to determine directionality. So your heart rate increases or decreases, that could mean different things in different contexts. And the model, the AI, is never going to have that context if you don't give it to it. It's not going to know if they're getting better. It's just going to know their heart rate went up or down. And so what we found to be a big indicator after talking to doctors like Kenneth Rockwood, and some other specialists in the field, was activities of daily living. And these are used as a standard of care, and they can only be tracked in, John's master's project was doing an algorithm to detect ADLs, or activities of daily living, that I just mentioned. And he classified this using high-powered motion sensors in the ring. And so we can detect these ADLs through our hardware, which has to be purpose-built for doing that and can't just be done by any old wearable. And that allows us to determine whether they're able to perform, whether they're performing their daily activities better or worse, which gives us the context to then understand the rest of the metrics that we're capturing. So we don't capture less metrics, but we capture something unique that allows us to do a very different thing with these biometrics. And one of the huge potentials is that now that we have this initial data, any other data that's entered into our system, whether through a partner company or through a secondary product, then gets that same benefit of correlation. And we've developed a system that can allow us to understand different streams of data and what they mean with respect to each other, as well as over time. Meaning artificial intelligence, instead of seeing a string of numbers, understands what a heart rate is, understands what walking is. And that's what we've spent years working on, is determining a way to turn this raw data into meaningful context that we can present in a way that nurses and care staff, family members can understand what the trends mean. Without giving a diagnosis, we can give you the tools that you need to understand something at a glance. When we show the demo, it's a pretty quick close once we get to that point, because they see the potential of this. And it allows, even if you're pitching to a CFO, when they see it summarized in a way that they can actually understand what's going on, it's then sort of our differentiating factor and makes these pitches go very differently than, we had anticipated a lot more pushback. But once they see it and they can understand it, it makes all the difference.
That's awesome. What's the cost? What kind of margins do you guys make? Who actually ultimately pays for it? Is it the family, or is it the care facility, or is it a bit of both?
Yes. So What our pricing model right now is we sell the hardware for 250 and we charge a monthly fee of 60 per resident per month. And that seems to be a sweet spot for getting people to see the value, because the second we get this into their facilities, they understand the potential and the cost savings. And it's nice because it does allow for better quality of care, but the real value of this is for staff efficiency. So in these
Mhm.
facilities, there's a huge turnover rate. It's actually 128% annual turnover rate. And most facilities are also hiring temp workers because of this reduced workforce. Context about what's going on with a resident gets lost a lot because the most experienced nurse on the floor leaves, or you're hiring a temp nurse. And by translating all of this into continuous context that can be transferred from one shift to another, we're really saving them a ton of time and efficiency on the nurse workflow.
Yeah.
And what we found most compelling has been our adoption rates and the time that it takes a nurse to get onto our system. It takes less than an hour for a nurse to start consistently using all of the features of our app. The alignment that we have right now with the workflows and how the nurses come onto their shift. And the first thing they do when they open the iPad on the app is go through and check each resident's insights. And they found this to be very helpful for giving them direction as well as continuing the context from one shift to another. So you reduce the downtime between these shifts, you reduce the downtime between catching a new nurse up to speed. We found that's been a huge benefit. And if you quantify this into cost metrics for them, how much time they're saving on this nurse efficiency, it's very substantially outweighing the cost by an exponential factor.
That's great. What are some of the things that have surprised you and what made you realize we have something really special here?
Yeah, we come from a very academic background. We both do. And
Yep.
that's the approach we took to this. And during our pilot and previously throughout Creative Destruction Lab, we've had inbound interest that we just did not take because we wanted to make sure the product fits seamlessly into the workflow, not just worked, but actually was usable. And when we deployed it, it would work from day one. And one of the things I was most worried about going into our first pilot, even though we had these metrics, was the adoption rate, just
Mhm.
because of the industry that we're in. And so we put the rings on the residents, and I get a call from our customer success person who's on the ground, and he says, I've been getting calls from the staff at the facility that the residents start crying when we try to take off their rings to charge them at the end of the week. They'll have full meltdowns because they become so attached to it and it connects them to their caregivers. So we solve this in a very startup way by giving them two rings where you take one off and have the other one already charged, and you can go clean it for them and put it back on, and it feels like they haven't really taken it off. So some problems like that, but I think the biggest thing we learned was how to make the workflow intuitive. And so not just presenting all of this information in a way that's understandable, but really creating something that without a user manual, you can open the app and intuitively know what priority you're supposed to do things in, the
Mhm.
exact order that you should do things in, sort of like an Apple product works, where it
Yep.
feels very easy and intuitive to navigate around, and you sort of understand exactly what to do when you open the app without anybody telling you to do it. So that was really something that we honed in on, and we're lucky enough to have a pilot facility where everybody was super supportive and was willing to give us the feedback that we needed to make this product good. And so I spoke to you earlier about how we've been securing some additional pilots. And so we hit the stage where the usage metrics were surpassing the benchmarks that I had set for, even the top level.
Mhm.
And so that's where we're really excited, that the product is there and we've got something scalable and the residents love it and the staff love it. And so now it's just about taking the next step.
Awesome. That's great. That's great. So you guys are both relatively new entrepreneurs. Is this your first venture that you've gone out and done where you're going to raise capital and have built a product?
So for me, this is actually my first venture.
Yeah.
Isaac introduced me. I work after did my master's in the universities. I did in working in the industry for 7 years
Mhm.
to deliver those prototype to master productions in the top tier automotive manufacturer companies. And what I found that has been so beneficial for the company is now I have more experience to really deliver the product from like a giant company perspective to from prototype to master productions, and all the nitty-gritties from suppliers, supply chains, how actually all the potential risk, all those stuff, have great experience. So that's I found super beneficial to my previous experience in this, and also because I think this is really my passion from a derivative or like passion of my master's thesis studies is that's kind of like driving everybody's, with my grandmother's, she is right now having some health issues in China. That's really also worried me, but nothing I can do. So that's like brought me, if we can really remote monitorings from, different countries, that could solve a huge issues, not just like in my personal life, but I think many families.
Right.
Yeah.
Yeah, for Isaac, I think.
For my end, I haven't had anything that I would say is strictly startup environment. However, when I was still in university, I founded an organization or a chapter of an organization called iGEM. It's sort of niche biotech, but they hold a yearly competition where you act as a startup in a sense, and you have a year to develop a biotechnology product. And take it to competition, and then you pitch, and there are a ton of venture capital funds and investors there, and a lot of those companies actually do get funded. And so I founded and was the president and lead of R&D for that while I was in school, which exposed me to the startup sector. So I did have experience with, I guess the cross-functional leadership you need to have while you're doing a startup, which is very, very different. You're responsible for everything, regardless of roles or positions. If something needs to be done, you have to do it. And I love that environment where, everybody's sort of helping each other out and you're bootstrapping and getting things done. But this is my first, I'd say, official startup situation. But that was a good intro. It was sort of like a beginner startup, if you will.
Yeah, that's great. And listen, everybody gets their first start somewhere. The fact that you guys are doing the first one here, one of the things that's caught my eye is you've added Kevin Rimmer. I've known Kevin, gosh, I think over 20 years now. He's a warrior, very active in any company that he gets involved in. So he's a great addition to your team, as you guys realize. So I think that's awesome. All right. So listen, you guys are earlier in your careers, which is great. You're going to get tons of experience, a lot of knowledge from this process. If you guys take a look at what you're working on right now and what the hard parts are, what needs to happen in our ecosystem here in Atlantic, Canada? What is it that our market could do a better job to support you guys as entrepreneurs?
I went to school in New York, so I was exposed to some of the ecosystem there. And
Yeah.
definitely there's a lot more capital, but I think the biggest difference is culture of innovation, and the speed at which things move in different markets is a little faster than here. And maybe that's due to funding, but I think it's also due to, in my experience over the past few years, the adoption of artificial intelligence. And over there, that's a huge thing and very normalized. Whereas here, I think there's a little less AI literacy among the typical crowd that we'd interact with in the ecosystem.
That's right.
And there are companies that I would say act as in what I would put as a wrapper around artificial intelligence, but
Sure.
there
Yep.
aren't a lot of companies that truly build so that as it improves, they'll improve. And those are the hyperscaling companies that we see all over getting funded. And I think just in my eyes, there's a lack of interest in it. I'd say in building something that's truly like agentic, or I guess future-proof companies were very there's a lack of adoption on that front. But I would say too is it is more difficult to raise capital here. And the thing that has been beneficial is the willingness to help. So I'll caveat it with that, is that everybody around here is very much so willing to help, and there is a sense of community. Um, but I do think that the lack of software innovation, in a sense, has been difficult, because you go in to explain things and you're competing with products where you are very different from them. But due to the lack of literacy in that sense, is they're adopting products that might not actually be what they say they are. And so a
Sure.
lot of
Yep.
people fall into that trap.
I think that certainly shows some wisdom beyond your years.
Yeah, especially just a quick example about the beneficial actually being in Canada is one of the early investment to really kick EXO started is I met somebody from the federal government NRC to really give the fundings. We are actually one of the fundings to receive large NRC fundings at the very beginning stage.
Yep.
So, and because my background is pure technical and people just, as you mentioned, willing to help is really give the knowledge of all the startup, all the business operations, which is, I think, a huge beneficial for like startup, like founders. Is that's kind of become the double sword edge, especially for senior care industry. You know, government has been heavily involved in Canada. If we really want to push this towards a next level to a leadings in the North America, even globally, then we would love to see the government is taking more initiative, right? Maybe leadings, then the venture capitalists can follow, come into, because government such a play a big part in that. Instead, more capital driven is much easier, you know, people chasing the ROIs. But at the end of the day, we are chasing the same goal, right? We want
Yep.
to quality of life, quality of cares for our parents, for our grandmother. We definitely see the difference and the benefit.
This is actually a theme that I'm hearing a lot of lately. Over the last year, particularly in healthcare, for example, in Nova Scotia, as you know, there's a Buy Nova Scotia will be your customer. Houston's government has pushed that forward, and organizations such as the Innovation Hub with Doris Grant has provided opportunities for companies. But across the country, I think what we're hearing in that particular case is, and I certainly had experienced it myself with medical devices, is that our target market was always, well, it's US based because of the opportunity size, but also in that our Canadian government, provincially or federally, in many cases, they weren't buying our products. They say, we want to understand how to support Canadian. You'd say, well, give me a purchase order, give me a reference case, because a lot of foreign customers can't quite understand, why don't you have any customers in Canada? That's an area that I'm hearing more and more. John Ruffalo of Mavericks has spoken a lot about it, as well as others at recent conventions. I think it is an area that certainly needs more spotlight.
Yeah, I have done a lot of thinking on that, specifically for Canada and the ability for them to adopt it. And one of the things that I find is I think we're too careful in a sense about a lot of this. Whereas in the States, one of the things that you hear constantly is the faster sales cycles. That could be due to just the structure and their ability to do these pilots in the government at a fast pace. But from our experience, you know, you shy away from government contracts or funding just because of the length that it takes to close them. And for a startup where, you know, you're growing fast, you're gaining traction, you've got potentially, you know, a price round coming up, is you want to keep that ball rolling. And if the government comes to you and says, hey, it's going to be 8 months for us to go through our due diligence, even though, you know, you've been audited by XYZ funding agency, you've got pilots going on, we have to do our own, right? You know, to me, it's a little silly. Especially if you're just going to do a small contract or something like that to get it rolling. But to get any sort of discussion with them, it takes months, and that's difficult for us. Like, we appreciate all the support we've gotten from them, but when you get into the stage where you're going fast, I think that's why companies move out, is because of the length of time that it takes. And there are big contracts up for grabs, and the companies who stay long enough or grow big enough will get them. But for a company like us, it's tough because we don't have the runway to wait 8 months. Like, we need to secure additional pilots to de-risk our investment. And that's going to force us, just, you know, due to market competition and necessity, to look elsewhere for them if we can't get them nearby.